Home First is an initiative from the Ontario Ministry of Health and Long-Term Care. It was first initiated in 2012 to focus on keeping patients safe in their home for as long as possible with community supports. It's a philosophy, a way of thinking. It puts the needs of the patient at the center of the healthcare system. The focus really becomes one of providing the right care at the right time and in the right place. The Home First philosophy guides us to look at discharging all patients admitted to hospital home as a first option once their active medical care is completed. When a person enters hospital with an acute episode, every effort is made to ensure adequate resources are in place to support the person to ultimately go home on discharge. It is a belief that any decisions about major lifestyle changes should be made from home and not from hospital during a stressful time. The main benefits of this way of thinking for patients and families are: the patient can recuperate better in a familiar environment. It reduces the risk of losing strength from not being mobile during the hospital stay. It gives the patient time to recover from the illness. The patient has time to see how he or she can manage at home with increased services and help. The patient and his or her family has the time to understand the implications of moving to long-term care while being in a better position to judge what is best for them. How does Home First work? With the help of the patient and family, the hospital discharge team, which includes a social worker and a Community Care Access Center or CCAC care coordinator, will meet with patients and families to look at their specific needs. Together, they will design a plan of care to suit their needs. The discharge planning team will create a detailed picture of the support needed to help patients and families make the transition from hospital to home. The CCAC care coordinator will help put together a service plan to safely support the patient in their home environment with a goal to maintain quality of life at home. The types of services offered will vary according to the specific care needs of the patient, but could include professional services such as nursing and physiotherapy, and personal support services for bathing, dressing, and daily care. Once the patient is at home, the care plan will be closely monitored by the patient, CCAC care coordinator, and modified as needed to support the patient's needs. Regular meetings with the CCAC care coordinator in the community will occur to assist patients and families to make important decisions about future planning and the ability to stay at home. Should it not be possible to stay at home, the CCAC care coordinator will help the patient and family plan for alternatives such as applying to long-term care from home or accessing other community services that would help better meet the person's needs. Most patients who access services from Home First are able to remain at home even after the program has finished. How does Home First help with the healthcare system? It ensures a long-term care bed will become available for those patients who need it. It helps improve patient flow through the hospital. The increase in the support and services offered at home will decrease the number of unnecessary emergency department visits. By reducing the time people wait in hospital for their discharges, it increases the number of beds available for patients who need acute medical care like surgeries. Home is the least costly healthcare solution for the medical system. This philosophy has been integrated throughout the 14 LHINs in Ontario. In working with CCAC and endorsing the Home First philosophy, the Ontario hospitals endeavor to put the patient first by providing the right care at the right time in the right place.